Clark County and the state of Nevada are each moving ahead with legal action against more than a dozen pharmaceutical manufacturers and distributors. They're suing to recover the cost of taxpayer money for civil services like police and paramedic response, as well as hospital costs tied to opioid abuse. One of the key attorneys involved is Robert Eglin.
This has been the biggest cash cow probably in U.S. history for the pharmaceutical industry, these opiates.
Eglin says the big pharmaceutical companies were deliberately making and distributing an inordinate number of pills, then flooding communities in numbers far beyond what was needed for legitimate use in a process called diversion.
And diversion is taking legitimate drugs from the legal market into the illegal market. And one of the most common ways to do that is through glut.
A prime example, according to Eglin, Lincoln County.
Lincoln County's got a population of 4,200 people, and yet over a 7-year period, we know that there was close to 1.9 million pills into that town. Now that's 4,200 men, women, and children. So one small town with one pharmacy. They can't possibly consume all those pills.
According to DEA ARCOS data analyzed by the Washington Post, that works out to 63 pills a year per person in Lincoln County. Even more disturbing, Clark County, where more than 1.6 billion pills were distributed between 2006 and 2012. That's more than 109 pills for every man, woman, and child. But opioid distribution in Nevada was highest in Nye County, with a staggering 127 pills per person in that 7-year stretch. The DEA declined comment, citing ongoing litigation, but did offer News 3 this statement that says, in part, the DEA remains committed to ensuring that patients have access to the medications they need, while at the same time ensuring that potentially harmful substances are produced in the appropriate quantities as to avoid diversion and misuse. Eglin says the drug companies were required to develop ways to prevent diversion and report it, but didn't.
We have example after example of them going years and years distributing millions and millions, sometimes billions of pills to communities without one suspicious order being reported to the DEA. Just refused over and over again. Why? Because they're making so much money.
Eglin says attorneys are still working up an exact dollar amount for damages in the county and state cases, but nationally, with hundreds of similar lawsuits underway, he sees damage awards surpassing another notorious case.
My personal view is this case is much bigger than big tobacco.
Steve Wolford, News 3.
We want to remind you of our commitment. Our look at Nevada Addicted continues every Tuesday and Friday night.